Welcome to the Clinical Podcast Series brought to you by the American Academy of Optometry Foundation and the Clinical Binocular Vision and Pediatrics Care Channel. Today's topic, Vergence and Accommodation Deficits in Children and Adolescents with Vestibular Disorders. Today's episode is hosted by April Jasper. The topical editor is Maureen Plaumann, and today's topical expert is Marielle Reidy. Now on with the show.
Hi, everyone. I'm April Jasper, and I'm speaking today with Marielle Reidy. Marielle received her OD and MS degrees from the Ohio State University College of Optometry, followed by residency training in pediatric optometry and vision therapy at Southern California College of Optometry. She then returned to Ohio State, where she is now a clinical instructor and PhD candidate. Marielle is a fellow of the American Academy of Optometry and serves on the FAAO nominating committee. Today, she will be discussing the December 2022 Optometry and Vision Science paper entitled Vergence and Accommodation Deficits in Children and Adolescents with Vestibular Disorders by Chin et al. Marielle, thank you for being here.
Thank you so much for having me, April. I'm so excited to be here.
So tell us a little bit more. What was the purpose of this study?
Yeah, the goal of this study was to better understand the prevalence and types of vergence and accommodative deficits in this population of children and adolescents with vestibular conditions. And they looked at this in a couple of different ways. They looked at vergence and accommodation first with specific diagnoses, people being diagnosed with convergence insufficiency or accommodative dysfunction. Second, they looked at raw numbers on specific clinical tests. So the amplitude of accommodation in diopters, for example. And the third was the frequency of failing any of the clinical tests. So, for example, falling below the cutoff criteria for normal amplitude of accommodation.
So who did they include in their study, and what was the testing battery for both vision and vestibular?
Yeah, they did a lot of testing. There's quite a comprehensive testing battery for these kids. It was a retrospective study of patients who had undergone vestibular and optometric evaluations at the Children's Hospital where the authors work. Patients were between 6 and 22 years old, and they were divided into subgroups based on their vestibular status. So the three different groups were a vestibular diagnosis only, a vestibular diagnosis and a preceding concussion, or just a concussion with no vestibular diagnosis. And then they also compared these kids to a group of 7 to 12-year-olds who did not have vestibular diagnosis or concussion, who had also been previously tested by the authors. The vision testing included a comprehensive dilated eye exam with a cycloplegic refraction, as well as a binocular vision evaluation, which included what you would expect of a binocular vision evaluation, cover test at distance and near, NPC, negative fusional vergence and positive fusional vergence ranges, vergence facility, amplitudes of accommodation, monocular accommodative facility. So that's all just the vision testing. Then they also had a vestibular workup, and they were diagnosed with one of three main conditions: benign paroxysmal positional vertigo, vestibular migraine, or persistent postural perceptual dizziness. Some patients did have additional vestibular diagnoses as well, but everybody had one of those three if they had a vestibular diagnosis. And then for everybody, whether or not they had a concussion was diagnosed by a neurologist or a sports medicine doctor.
Wow, sounds very comprehensive.
Yes.
So given all that workup, what are the highlights our listeners should know about?
Well, as you might have anticipated, the vestibular or concussion group as a whole showed higher frequency of vergence and accommodative deficits compared to the control group. This is seen with, first, the higher rates of binocular vision diagnoses. In the vestibular and concussion group, 35% had some type of vergence deficit compared to only 3% in the control group. And in the vestibular concussion group, approximately 64% had some type of accommodative deficit compared to only 13% in the control group. The kids in the vestibular concussion group also just had poorer performance on tests. As you can expect, accommodative amplitudes were better in controls than all of the subgroups of the vestibular and or concussion group. And the same was true of their base outbreak value. NPC and accommodated facility were also worse in 2 of the 3 subgroups compared to controls. And finally, we had a higher proportion of patients failing at least one measure of Vergence or accommodation compared to controls. So no matter how you slice the Vergence and accommodation testing and deficits, these kids with vestibular and or concussion conditions are performing worse than controls. There is so much data in this paper. This is really just the highlights. There's tons of really great tables and awesome figures in this paper. And I definitely recommend any interested listeners to pull the publication up to look at it in more detail, because I couldn't possibly cover it in just such a short podcast like this.
So what insights do the findings from this study give clinicians who are treating these patients?
I think the biggest takeaway is just knowing about this higher frequency of the comorbidity for binocular vision issues in patients with a vestibular diagnosis, and that warrants a detailed visual function evaluation. But I also think that kind of goes both ways. If we have, as optometrists, we need to do a better job of networking with other healthcare professionals to make sure that we're an integral part of the symptom management for these patients. But also, if we're working with a sports medicine doctor and we've got someone with a concussion that we're doing a vision evaluation on, we need to remember too that a multidisciplinary approach to their treatment is going to include a vestibular workup as well.
Absolutely. Sounds great. Marielle, thank you so much. Appreciate being here. It's a blessing for me to be able to listen in and be part of this as you share your insights. Thank you.
Thank you so much for having me, April. It's been fun.